vaccine every single day, but some leaders in the Hispanic community say the messaging might not reach their members.
It starts with creating bilingual information, but goes much deeper than that. Kevin Barry explains how Cleveland's Hispanic organizations are making sure the vaccine gets into its community as soon as possible.
It's super important for everybody to be educated on COVID and the vaccine and everything that's going on.
That's why Manola Acosta answered the call to become a Cover or COVID ambassador in Cleveland's Hispanic community.
Certain communities have been hit harder than others, including the Hispanic community, for a variety of different reasons.
The CDC says Hispanic people are most likely to go to the hospital and die from COVID compared to all other groups in the United States. So Manola is using her bilingual language skills to translate information into Spanish as part of Dr. Raul Schwartzman's work.
Information, there's a lot. Now, the way it's communicated is a problem.
That's why he helped create the group Cover or COVID, which encouraged people to wear masks and keep socially distanced at the start of the pandemic. Now, the effort is also convincing Hispanic residents to get vaccinated. And he says big hospital systems might not be the best messenger.
People, I think, are kind of tired of being told from the finger from up, saying you have to do this. We know how it is. You follow our instructions. People say, I don't need to.
That's where ambassadors like Manola come in. They're family members and neighbors who have trust in their community that even the big institutions might not.
I have no investment in anything. I'm just really here to try to help people, educate them, and answer any questions that I'm able to for them.
Jose Feliciano's Hispanic Roundtable is using its network to help out too.
The message has got to be presented not only bilingually, but biculturally.
That's why he says he'd love to see vaccines delivered in churches in Cleveland's Hispanic community. It's already a community gathering spot that people trust. The only barrier is logistics.
We have to raise the comfort level of those that administer it, that those venues are acceptable from a medical perspective.
It would also help clear one of the big reasons that Dr. Schwartzman says Hispanic people have stayed away from medical care in the past: immigration status. Feliciano says most of our region's Hispanic population is Puerto Rican, so they're already American citizens.
It's less of a challenge. It's a challenge nonetheless, one that we have to be sensitive to, but it's not as big a problem as different parts of the country.
And just last week, the Cuyahoga County Board of Health Commissioner Terry Allen urged healthcare providers to check IDs for name and date of birth only, not for immigration status. Medical experts say that's good because everybody benefits when more people get the COVID vaccine. In Cleveland, I'm Kevin Barry, News 5.